The World Health Organization is reclassifying the COVID variant that is spreading in India as a variant of concern at the global level. The triple mutant variant is highly contagious.
It's scary, and right now there are only a few reported cases of it here in the U.S. It's not known if it's in our area, but in tonight's Facts, Meg Ferris is explaining what it means and how to protect yourself.
By now you've seen the COVID suffering in India, the illness, deaths, and mass outdoor funeral pyres. And now the headlines: the World Health Organization classifies the triple mutant COVID variant from India a global health risk.
They've got some evidence that the virus is either more transmissible or is able to evade the immune system a little better.
So what does that mean to you and me, and what is a triple mutant? Tulane's Dr. Bob Gary tracks emerging viruses, and he says there are 3 changes in the spike protein gene. Those spikes are what the virus uses to latch on and invade each cell. So can it completely outsmart our natural immune systems?
But so far, none of the variants, including this Indian variant, are able to completely escape the immune system.
So can the Indian triple mutation escape immunity from the vaccine?
So we know that the vaccines work against this Indian variant. They work pretty well, but what they do very well is to prevent people from getting really sick and from going to the hospital.
So Dr. Gary says that's the important message. Vaccines protect you from getting serious illness from all variants.
And Dr. Gary, the people who are choosing not to get the vaccine, they're going to be more susceptible to serious side effects or even death if this variant from India comes to the United States?
There is pretty good evidence that this new variant from India is more transmissible and somewhat more deadly, so people get sicker. So you're really playing with fire if you're not getting this vaccine.
And he says it's why children should be vaccinated, even though they're at low risk for serious illness from COVID. If the virus can't spread from person to person, it can't make new, more deadly variants. For Facts, I'm Meg Ferris.
And as the virus changes, it's highly likely that down the road we may need to get a booster shot, just like we do with the flu vaccine. Good news is the technology makes it easy and fast to change the vaccines to keep up.